The topic of presentation is applications of big data analytics in disease. The flow of presentation is first we will be discussing about basic introduction to big data analytics. Then we will be discussing about overview of applications, means how many applications of big data analytics are in present. Then we will be discussing about applications of big data analytics in disease, and then we will be discussing about the references from where we have been taken the whole content. The first we will discuss that what is the big data analytics. So before going or starting with this, I need to give in just an example with your daily life basis. Like I could say that boys would understand it much better. जैसे जब बॉयज को कहीं पिकनिक वगैरह पे या कहीं भी जाना होता है ट्रिप पे, तो आपके पापा एज यूजुअल बीइंग स्ट्रिक्ट वो आपसे कुछ क्वेश्चंस पूछते हैं कि आप क्या कर रहे हो, क्यों कर रहे हो, उससे क्या होगा, है ना। तो सिमिलरली व्हाट इज देयर इज कि जो बिग डेटा एनालिटिक्स है, तो बिग डेटा एनालिटिक्स क्या है? बिग डेटा एनालिटिक्स एक प्रोसेस है कलेक्टिंग, एग्जामाइनिंग और एनालाइजिंग का, जिसमें वो क्या करता है, डाटा को एनालाइज कलेक्ट करता है, इकट्ठा करके फिर उस पर एग्जामाइनिंग करता है, उसको देखता है, देन उसको एनालाइज करता है, देन वो क्यों करता है, ठीक है, और मतलब क्यों वो लार्ज अमाउंट ऑफ डाटा को करता है, सब चीजें, ठीक है। देन इज वो उससे क्या होगा, जैसे पापा पूछते हैं ना वहां पे जाने से क्या होगा, वैसे ही बिग डेटा एनालिटिक्स होने से क्या होगा। बिग डेटा एनालिटिक्स होने से जो मार्केटिंग ट्रेंड्स हैं या मार्केटिंग इंसाइट्स हैं या जो पैटर्न्स हैं वो न्यू न्यू डिस्कवर होते जाएंगे, और इससे बेटरमेंट में ही हमें सहायता होगी, किस चीज के बेटरमेंट में, द बेटरमेंट ऑफ द बिजनेस डिसीजंस. So big data analytics in healthcare will allow to use new technologies both in the treatment of the patients and as well as the management of the health. A term used to describe a massive volume of information created by the adoption of digital technologies that could collect the patient's records and manage the hospital performance, or otherwise we could say that managing the other professions in the healthcare sector, not only hospitals but any like pharmaceutical industries we have. Okay, we have pharmaceutical companies, so for that also it is used, otherwise too large and complex for the traditional technologies. So big data analytics is very large, and it is basically dealing with the complex data, dealing with the large amount of data, and it is kind of a traditional technology which have been developed. Let's move on to the applications which will be further described in a comprehensive way. First is the patient's prediction for the improved staffing. Second is the electronic health records. Third is the real-time alerting, enhancing the patient engagement. Fifth is the prevention of opioid abuse in the US, using healthcare data for informed strategic planning. Seventh is big data might just cure cancer. Eighth is predictive analytics in the healthcare, and like reducing the fraud, telemedicine, big data style with the medical imaging. Okay, then we are preventing the unnecessary ER visits. Okay, then there is a smart staffing, maintaining a smart staffing plans and the strategic plannings for the management of staffs and the other personals, and then we will be further discussing about the advanced risk and disease controls, and there are many more applications. So the first is prediction, patient's prediction for the improved staffing. So the one of the classic problem that any shift manager faces is कि किस तरीके से staff को manage करना है, और अगर कितना staff required है on the day, हमें मतलब सब कुछ manage करना पड़ता है कि हमें मान लो अगर patients ज़्यादा आने हैं उस दिन, तो हम लोगों को पहले एक staffing arrangement proper करना पड़ता है ताकि जो लेबर कॉस्ट है वो एड ऑन ना हो पाए, ठीक है, या जो मतलब जो भी हमारे कस्टमर्स हैं वो सेटिस्फाइड हो जाए हमारी सर्विस से. तो वन ऑफ द क्लासिक प्रॉब्लम दैट एन शिफ्ट मैनेजर फेसेस, हाउ मेनी people do I put on staff at any given time or any given period of time. If you put on too many workers, you run the risk of having unnecessary labor cost add-ups, and with too few workers, you will have a poor customer service outcomes, which can be fatal for the patients in that industry. So the example is that we have a white paper by Intel, which is basically used in United States. A white paper by Intel have been using data from a variety of sources to come up with the daily and hourly prediction of how many patients are expected to be at the facility on the given time, or in the period of 24 hours. So the data driven scheduling and the resource allocation activities, frontline staff and the freed from the tedious clerical responsibilities and focuses primarily on the caring of the patients. So this is how the prediction before management of staffing is done. Then is EHRs. EHRs are the electronic health records. Maintaining of the EHR is, kind of in data collection in such a way so that the we could have in proper demographics, proper progress notes, problems, medications, signs, medical histories, any kind of immunization, laboratory data, or the radiological reports. So what we can do is we can collect the data and store it at a place, so if in future if we would be requiring for the same, so we can go through that and we can serve the patients more appropriately. The EHR automates access to the information and has the potential to streamline the clinical workflow. EHR has the ability to support other related care related activities directly or either indirectly through various interfaces, including evidence-based decision support, quality management, and outcome reporting. Also, we have like EHRs. Some of the EHRs also have, I mean, we could say alarming, system of alarm. Like what it will do, it will trigger the warnings and it will make the patients reminders to be in the compliance with the medication or to adhere with the medication route which basically was prescribed by the healthcare professional. Now, next is this is just an example of how HR looks like, how HR record is done. Okay. Now let's come on to real-time alerting. Real-time alerting is a kind of an AI platform is developing nowadays, and what it is doing is it is uh, significantly making a growth in the healthcare sector also. So similarly, we have an real-time alerting. Like I can give you an example. We have an two, or we could say MD, a medical device, uh, which triggers the warning as soon as we have a high rate or excess of glucose in our blood. So similarly, real-time alerting, what it does is it provides the benefits to the healthcare providers significantly from using the data already, which was driven already, and the real-time alert systems to track the issues like medication adherence, adverse events, and drug cost inflation. Artificial intelligence identifies the challenges, the approaches for the opportunities for the improvement in sending a timely alert to the right people. Okay. This early warning system equips pharmaceutical professionals with the knowledge and the insight to pivot rapidly whenever a drug concern comes into light. So, what benefits are there? Like providing patients assistance, we will get a good assistance pattern for providing to the patient. We will be optimizing the disease management. We will be managing the drug inflation, customizing the alerts to meet the specific needs. Now, enhancing patients' engagement. Many customers and hence potential patients already have an interest in smart devices that record every step They take their heart rates, their sleeping habits on a permanent basis. All this vital information could be coupled with other trackable data to identify the potential any kind of potential health risk which are being lurking. Another way to do so comes with the new variables under development, tracking specific trends and relaying them into the cloud where physicians can be monitored. See, then healthcare virtual assistants like we have chatbots, we have a AI powered patient self-service portal, we have a 360-degree view of patient, we have a risk assessment for the preventive care, we have a healthcare workforce optimization. Similarly, we can go with prevent opioid abuse in the USA. Like we could say, we have right now the research is going to measure the risk connected with the prescribed opioids. Researchers are experimenting with artificial intelligence so that it could be less time and money consuming and could provide a billion of screening, not taking too much large time. Okay, true, it could be time effective, timely effective, and cost effective more. Now, big data might just cure cancer. The AI big data analysis may automatically generate patient diagnosis, personalized treatment plans, and key information for prognostic predictions. And we can also say that AI system can detect minute anomalies often missed by the human eyes, reducing false negatives. Artificial intelligence has revolutionized cancer research and treatment by identifying intricate pattern in medical data and providing quantitative evaluations of clinical conditions. Now it would reduce and enhance the security, reduce the fraud and enhance the security by personalizing the data in a proper way so that we could get even a profit in a black market, right? And also advancing in security, like such as we could have encryption technologies, firewalls, antivirus softwares, answer the needs for the more security and benefiting broad largely overtake the risk. Now next is telemedicine. Telemedicine is kind of an online video conferencing through smartphones or any kind of wireless devices and connecting to the healthcare professionals by sitting at your home relaxed and just giving the proper prescription, proper drug compliance chart and everything. So now like it is being working like we are bringing the robots who will be high speed real time data providers and they're providing a great amount of advancements we could say and it would help the patient's conditions deterioration should be prevented by that. Now, next is integrating big style data with medical imaging. So, medical imaging is in kind of imaging the data of the individual. It is generally done by radiologists, and in each year in US, about 600 million imaging procedures are performed. So, it is very it is still growing. Not to the end. It is still growing and a way to prevent unnecessary ER emergency rooms. So to prevent future situations from this being from happening, Alameda Country hospitals came together to create a program named Pre-Manage ED. This is another great example for the application of healthcare data analysis, which is generally useful and is much needed. And in the past, hospitals with pre-manage ED would repeat tests over and over, and even if they could see that the tests have been done at the another hospital, they could go to the old school and request to send along fix just to get the information they needed. So these things can be, provide an advantage. ERs could, like we have emergency rooms visits. We could not, what we could not do is we could not go there and visit. Okay, we can just relax and collect the data, sitting online and doing everything. Smart staffing and personal management, it has already been discussed in the first point also. And similar is like in this, it is the example of HRs that was for the staffs. This is for HR analytics and the workforce management task. Okay, and then there comes as learning and development. So by keeping track of employee. Then we have advanced risk and disease control. So we can analyze the data. Doctors can foresee if there is a risk of a decline. Means through the AI platforms, there are various AI platforms which are helping in finding the risk. And even I'm telling you that they are finding the advanced risk and disease controls. Now, suicide and self-harm prevention. So there are various studies, okay, which are providing um, uh, self-harm prevention, right? So there are a number of alarming systems, right? If someone is going through the emotional pain, okay, we can go through that and we could get the alarm and we can tackle those difficulties using the big data uses in healthcare, and they could make a positive change even. Now, improving the supply chain management, and there is a financial facility management, then developing new therapies in the area of innovations. Then we are just tracking the mass diseases and managing them, like we had COVID-19 earlier. There is also an advantage of improved drug prescription processes. We could improve the prescription processes by revolutionizing the patient's care, controlling the diseases, and further doing everything on the fingertips in the few seconds. Now we also have a very so many um, alerting we have personal devices, right? So we have devices for detecting the AF, that is the atrial fibrillation. We have so many Bluetooth devices. So these are the type of big data analytics: descriptive, diagnostic, predictive, and prescriptive. Now, these are the benefits. Benefits are big data analytics help in capturing, processing, analyzing, and visualizing the data. So, what I concluded is that big data analytics is a kind of in data collection, preparing of data, or kind of a model which prepares data. It helps in evaluating, deploying, and monitoring the data too, and observing whether the things are done in a compliance, done in a better way, and effective and performed well, so that there could be no loss of time, no loss of money, and we could get a huge benefit. So these are the various references. Thank you.